Okay, this is another episode of Candid Convos, and today I have Dr. Karen Scott, the most infamous OBGYN that I know, because she delivered my firstborn, and she is an excellent doctor. And she's here to share some tips and some her medical expertise on what is going on right now. So, can you properly introduce yourself, Dr. Scott?
Hi, my name is Karen Scott. I am a physician. I'm an OBGYN by training, and my pronouns are she, her, hers. I am also a sexual, reproductive, and perinatal epidemiologist, which just basically means I love to look at how certain outcomes or conditions, how often they occur, where they occur, who's most impacted by it. I look at trends and patterns, and I really like that. And I like to also use data to transform people's consciousness and also help in the redesign of healthcare systems.
Okay. So she helps the reproductive system. And I see and I've heard a lot of women lately have a lot of trouble with fertility. And I don't
Mhm.
know if that is a woman thing now, or can you give a little insight on what's going on?
So yes, there are not everyone, right? So I should say that not every sexual encounter or experience leads to a pregnancy. And there are different um, types of challenges that people who have the capacity to get pregnant are not able to do so. And some of those conditions can be, as we say, could be female related, meaning people who have a vagina, uterus, the tubes and the ovaries, or it could be a male issue, meaning is there something going on um, with the sperm, the semen, the count, the consistency, how mobile. And so there are particular or specific specialists, like a reproductive endocrinology infertility specialist, who um, people can see, sometimes depending upon their insurance, though, which is an equity issue because all folks should have the right to build a family. Um, there are challenges around like how do you first get pregnant, and then how does one keep the pregnancy or sustain the pregnancy all the way to full term. And so there's different types of tests that we do in terms of checking like hormone levels, checking to see if there's anything inside of the uterus or anything blocking the tubes or anything that's impacting the release of the egg, which is ovulation. So we do lots of things by asking questions. We should be curious. When a person or a couple or a family comes in and they're unable to achieve a pregnancy. And traditionally, the definition of infertility initially was biased because it assumed that a person who was a male or a female were having sex continuously or frequently and unable to achieve a pregnancy within a year, that was considered infertility. But that biases, right, two types of bodies that are having sex to achieve a pregnancy. So really folks who are queer or gender non-conforming or non-binary, we have to have a more inclusive definition of fertility so that we support everyone's capacity and right to build a family and have all those things that they need to have a safe and productive and a safe, productive, and a loving, nurturing family and with the conditions in which they live. And so infertility can be a problem. Some people don't think that it's a Black problem. I wouldn't say that it's a problem within particular communities, but there is that kind of mistruth that Black women are super fertile. And
Yeah.
so right? And so because of that mistruth or a stereotype, there are barriers to supporting Black women who are unable right, to get pregnant. And I definitely want to lift up the fact that those are that Black women who are unable to achieve a pregnancy and to sustain that pregnancy, to lift their voices and their experiences up, because the healthcare system usually deems us as being, super fertile, and that's not always true.
So what stereotypes, or if any, have been taken away? Because you hear it all the time that we have a higher threshold of pain,
Mm-hmm.
or like you said, that we are considered extremely fertile. And even during child birth, I've heard a lot of friends say they've had issues with them doing C-sections too soon, or them not seeing the red flags of the baby not coming through properly. So, what red flags or things should people ask or verbalize during that time of trying to conceive or conception?
Right. So that's a really great question. And there are misconceptions, mistruths, and stereotypes around, right, our capacity to endure pain. So there's definitely been reports across the country. We remember Serena Williams' story,
Yeah.
Dr. Shalom Irvine, who was, an epidemiologist who was studying and examining maternal mortality, and also had a similar experience of just not being heard, being neglected, seeking care multiple times during her postpartum period, and subsequently like died within weeks of giving birth. And so we have tons of data, tons of examples, tons of lived experiences by Black women, mothers, and birthing people around not being heard, not being seen, not having our pain, not having reports of our pain to healthcare providers be believed. And then there's a lack of or a delayed response to whatever our report of pain, or if we've had surgery, like the wound doesn't look good, like there's a whole um, a culture of a culture of seeing Black women as unworthy or unreliable. And so even when we do tell our truth, we are not believed, and we're not even trusted to know what's best for our bodies. And so Black women, Black people, particularly in pregnancy, I would definitely encourage folks to ask like lots of questions, and to ask around, to ask that practice or that physician or even that midwife, what are their experiences supporting people who are birthing while Black? Just like,
Yeah.
what's your experience with that? Just, first off,
Right.
what is your practices? What are the values of your practice? What types of things do you do to affirm that birth is normal and physiological process? What types of things do you do to validate your patients' concerns, particularly if they are from communities who have a long-standing history of being, misused or abused or neglected or harmed or controlled, right?
Mm-hmm.
Coerced by government, by police, by child protective services. Like, I think if you have the capacity to ask questions and to make a different decision around who is going to provide your care, then that's awesome. You are able to exert your power and your agency. But we also know that insurance companies, right, dictate where we can get care. And so, what I would also encourage is that if you can have a doula, who is essentially, a person, a birth worker who is trained to provide social, emotional, and mental support throughout not only your pregnancy, but doulas are also there for your birth, your labor, your postpartum period. There are also doulas who support people through abortion. So really across the whole reproductive life course. But I can also personally say that as a non-pregnant person who sought help and health care in the emergency room in April at the end, that it was one of the most horrific experiences that I've had, because me being Black and woman wasn't enough. And then if you add on, I have the whole alphabet behind my name. So I
Yeah.
was also a physician. Um, I went because I had neurological symptoms, meaning I felt numb. I lost sensation of, I had a lot of pain, then I lost sensation of pain. I felt weak. I had numbness on both sides of my body. And I had to go to the emergency room 2 nights in a row, which
Yeah.
meant my issues weren't adequately addressed. At the same time, people were more concerned with like, are you pregnant? Are you sure? And when you say like, no, I know I'm not pregnant because I know the things you have to
Right.
do to be pregnant, I ain't pregnant. But they're
I'm a
again
doctor.
those.
I should know.
But no, but say like you talk about stereotypes, like I the stereotype of being right, a drug seeker was there, being pregnant and not knowing, or hiding the pregnancy, or not knowing that I was pregnant. Me being a Black woman, and I'm 44. Well, you must have hypertension and diabetes. I had gone to the emergency room the night before, and the nursing staff had difficulty placing IVs, which we know happens a lot.
Yes.
Um, a lot. And I also find that sometimes, I don't know, but I've heard that, like the force, the level of force attention that's used to do it, and if they can't find the IV, the frustration sometimes the staff had. So I have both my arms out with two different nurses trying to get an IV. So
Yeah.
of course, I have bruises then and track marks. So imagine going to the hospital the next night.
Yeah.
And so people thought I was like seeking drug. They're like, what, why does your arm look like that? And so there's this constant, we are constantly, as Black people, as Black men, as Black women, as queer people, as undocumented, as, immigrants, like all of that, we're constantly under surveillance and suspicion that whatever we say, no one believes us. Or and then how we respond to the disrespect and neglect that is actually happening to us, that is real.
Mhm.
When we respond to advocate and or defend ourselves, then the healthcare system particularly responds to us with language like non-compliant, disruptive, combative, challenging. Even when I facilitated focus groups with 37 Black women, mothers, and birthing people in Oakland and Los Angeles last year, they shared how, they will be pregnant and go to triage, and the nurses will be like, well, are you sure that you're in labor? And like, just to imagine you're
Right.
in pain, um, and someone asks you, are you sure that you are in labor? And so we're constantly having to repeat ourselves over and over again to just get the bare minimum of care and the bare um, minimum of dignity that we deserve
Yeah.
as human beings. And so that I would, again, just people need a doula. So I had a doula myself when after the emergency room visits. I ended up asking my friends, one is a midwife, one is a nurse, and they were my like primary care doulas.
Yeah. Now, I know you spoke of that before because there weren't a ton of them that were advocating for Black women, or wasn't enough Black doulas. So what is the process of becoming a doula? Because I think people have a misconception of what a doula is and what a midwife is. So are they one and the same, or how does that work?
So I'm going to try to answer as best as I can by saying I am neither a midwife nor a doula, but I love them. I have such respect and reverence for um, their expertise, their experience, the care, actually the love that they have when they are trained, that we as physicians are not trained to um, provide that to patients. And so
Okay.
for a nurse midwife, you definitely have to go. Well, there's several different types of midwives. And so what I will say in terms of a certified nurse midwife, that is one who does end up going to a nursing school. And then after nursing school, there's, additional training to become certified, and some people end up having both, being a certified nurse midwife or a women's like health practitioner. But that
Okay.
is like a professionalization of training and skills, so it requires taking a test and certification. For doulas, that a doula does not need to go to like a healthcare professional school, such as medical school or nursing school. There are doula trainings that are offered in different parts of the country, and the timing, the intensity, the duration varies, but you can become a doula without having, let's say, like a bachelor's degree. No, it doesn't require like a prior formal education. And they provide different types of support because one, as a midwife, is providing support, but also making decisions around your clinical care in your
Okay.
pregnancy, in your labor, in your birth, your postpartum. Midwives can also act outside the hospital to provide clinical care, like an office setting, in a outpatient setting, where a doula is really providing that type of social emotional support, um, being one's advocate so that they can ensure that what their needs and priorities are, that the healthcare system, the providers, are prioritizing that, like in the clinical decision making. So one can make clinical decisions, and the other one supports people to be able to make the best clinical decisions that aligns with like their priorities, their needs, and their values. So, but ideally they do work together. So like
Okay.
someone who's pregnant could have like a midwife and a
And the
doula.
doula. Okay.
Yep. And then like an OB like me could be asked to come into that healthcare space if there are things that are changing in the pregnancy, the labor, the birth that require me to like intervene with my particular skill set. But
Okay.
not everybody needs an OB, but I do believe everybody could benefit from having a midwife and a doula.
Okay. We need you there in case something arrives where it's a
Mhm.
fertility issue or it's a problem with the actual birth. Is that correct?
Well, so there are so the whole like this women's healthcare. I don't even. I mean not gender it. Sexual and reproductive health care, in terms of the clinical care, can be provided by like a nurse practitioner and an OBGYN. It can also be provided by family practitioners, or even internal medicine folks who want to specialize in reproductive health.
Okay.
Um, so but a physician and a surgeon are needed if there are particular things that are happening, certain conditions, certain diseases, or any types of injury or infections, anything that can impact the normal processes in the body. If there are additional imaging studies or tests, or sometimes a surgery, a minor surgery or a major surgeries are needed, that's more when an OBGYN is involved. If someone's health becomes impacted by like chronic hypertension or diabetes, um, or any other types of conditions, if someone has a pre-existing health condition, then yes, they would benefit from also seeing an OBGYN just to ask questions around like, how does my health condition change throughout pregnancy, labor, and birth and afterwards? And
Okay.
how does the pregnancy change? Because I have this condition. So that's one thing I definitely would encourage is are people just, having a full like social health exam, social and clinical exam, to just see what their health status is like, make sure their immunizations, if they believe in that, which I do, that they have all those things done, because pregnancy is a time period where, in order for the baby that's growing inside of someone, if someone chooses to keep the pregnancy, the immune system of a pregnant person is suppressed or made a little bit like weak, I can explain, in a sense, so that the pregnant body doesn't attack parts of the baby that are not from the pregnant person. And so it's just important to know just the normal changes of pregnancy, of what happens in birth, how you're breathing, right? Your breathing, your heart rate, even the movement of food through your body from mouth to like your esophagus, all those things change with pregnancy. And so it's just important that people understand normal changes and then understand the other types of changes that may require, right, additional clinical support.
Yeah. I think a lot of people are afraid, especially, when they feel like they can't conceive, and asking doctors or physicians if something's wrong with them. They don't like getting checked. They don't like getting pricked for blood work or anything. And then I've noticed issue when you have to get your breast exams, and they've said now, they're still keeping the age at 40, but I've had a lot of people that I've known or seen deal with breast cancer or breast issues in their early 30s. So
Mm-hmm.
is this something that because times change and people adapt to different things, are they going to continue keeping the age of getting certain tests done at so late? Or do you think it will evolve once they realize that, okay, this is not an issue like it used to be in your 50s, is now an issue in your 30s? A lot of people aren't even requesting tests for a lot of these things until
Mm-hmm.
they're 40, 45. So what can we do to advocate for that? Or do you think it'll be a shift automatically?
So you raise a really, really great question. And again, I'm going to speak from what I know as an expert, as an OBGYN, but what I can say very broadly is that we are aware of, right, that tension between cancer screening prevention procedures such as like a pap smear or a mammogram,
Mm-hmm.
um, and how, particularly with the mammogram for breast cancer screening, like there are certain professional like bodies who make those decisions around like, when is the most optimal time to get this test, and they create policies, right, that then your provider must abide by. And so the tension is that we know that there are certain like disparities or differences between the rate at which cancer is, diagnosed, and then
Yeah.
when cancer is then treated, and then how cancer can either go into remission or it worsens. And we know that those differences really are more than just a disparity, they are an inequity, because there are certain things that could be prevented, right? If our Black communities had access to care in a way that pre-cancer and cancerous changes could be identified. And we know that those barriers to getting care are things such as either insurance or even just trust. And so I think that though the age for getting a mammogram, is 50, and some of that reason is that at the one of the things that the breast consistency, like the density, breasts are more dense as we are younger, and so mammograms are not as effective at detecting changes with dense breast. But I also hear you saying that there are a lot of our loved ones and friends who have been diagnosed so very early. Is that how can we make good decisions for our health when the science says do this, but then we are seeing our communities experience that?
Yes.
And so I would encourage people to like, I truly believe in like, the trust with the healthcare providers, but then also how do we help facilitate conversations within our families around our health and around who, when people died, there's some, shame, internalized shame that people have around certain ways in which people die. But without knowing our own health histories in our family, then if we can know, right, who died from colon cancer, who had breast cancer, who had uterine cancer, then
They
we
just
could
say
be
they died. Okay.
right. And
What?
so I'm saying this to say is that not only do we not trust the health system, but we also, have internalized some things ourselves in our communities. And so if we could be able to have a conversation with our healthcare provider to say that like, hey, this screening exam says this, but I'm seeing all these people in my community
Right.
much younger. But I hear you is that we have many people don't have that trusting relationship with their provider to have that conversation. And some providers, because of the way the system has designed healthcare, don't even have the time to have that really deep conversation around people's fears of getting something that they see in their family or their community when the test is not supposed to be done like 20 years from now. So there's a lot of conversations, right, that have to be
Okay.
done, and people need to. It would be helpful if we could know like what types of conditions are occurring in our family, because maybe we are that group that needs testing sooner. Because if people have a family history, um, or other risk factors, then that may help make the decision around when someone should get a test. But it is tricky though, because I had a mammogram myself early because I had symptoms. And so that's the thing, is like, I want to advocate for people to know their bodies, um, to seek help when they can, when something is going on for a long periods of time. And that's why I think doulas are helpful, right? If there's a fear, I should say, if I was fearful, when there is fear around going to seek help or healthcare, I do think that's the benefit of having a doula who's not just there for your birth, but like a doula just to support an advocate, someone who could be with you in that space so that they know what's going on with your body as well as you do. That if in that moment, during that exchange between a provider and a patient, that advocate or a doula could intervene in that conversation like mine did, to be like, hey, let's pause. I want you to hear, as the provider, this is what the patient is saying, but I also want you to hear what you're saying, though you may intend it to come out this way, it's really coming out this way, and this is how it's harming the trust and the relationship. And so it requires a lot. It is like, it's trust and information that we need, and having a discussion around, you know, how beneficial is that particular test for you, depending on what's going on in your family, family history, and also whatever other conditions that could put you at risk. But again, like, we really don't, it's rare that we have time. It's rare that the provider
Yeah.
has time to
Because
really.
you have a ton of patients, and a lot of I've seen and I've read a lot of patients even during this COVID time that they've been complaining about, oh, I needed more time, or I feel like they should have been more detailed. And I'm like, do you understand that they are human, and they're there all day trying to figure out what's going on, just like you are, and running the tests and going through policies and trying to, dot the I's and cross the T's,
Yeah.
and it's like a never ending line. I'm like, you have to still be kind of, respectful on that note, that they are working overtime. It's exhaustion. And so we have to take the responsibility also to have those conversations at home. And so I've noticed, even with them not trusting either officers or the healthcare profession, they also, I know a lot of my friends don't know their lineage, or like say they
Yeah.
don't know their father's side. So I've always taken the time to know who's on both sides of the family, even if I don't have a relationship, because it along with giving you pride of it, it kind of helps you know what route in life you're gonna take. You go to a family reunion, it's like 7 photographers. You're like, oh yeah, that's why I like taking pictures.
Right.
So in that aspect, how important do you feel it is for them to know where they came from as much as possible, to see if this is something that like it could be something simple as blindness. Is this something that they should get checked, or at least have trust in their family line about their health?
Yes, and you raise very important questions, especially around people who have different, like, their families were formed in different ways, or they were brought into a family in a different way. So if we think
Yeah.
about people who were adopted, like, they, whether it was a closed or open adoption, they just may never know. And
Right.
so again, the person is relying upon, just like, they're relying upon their awareness of their body, and just have to have a conversation, right, with a trusted provider to know when certain tests should be done at a certain time, or should they be done sooner. And for people who, for me, like, I have siblings, what I call like my paternal and my maternal, like I have on both sides of my
Yeah.
dad
Okay.
and my mom. And so we know that, like, we know that in all communities, but particularly in our community, like, we have, our families are formed in different ways. And some people we call auntie and uncle ain't got no blood relation,
Right.
but they're auntie and uncle. So I think, it requires a lot of courage, really, like a lot of courage, a lot of vulnerability to be able to approach people who you may not have had a relationship with in your childhood, to be able to say, like, hey, I'm doing that even now. Like, I want to get to know my siblings. I wasn't really thinking about health wise, but just like, I know, especially in this time of COVID and living alone, and we're in, right, social isolation, like, I just really want to know who my family is. I mean, like you said something about, like, you went to a reunion and saw that a lot of people like photography. I realized a lot of the Scotts are either lawyers or musicians, and I love music. And though I'm not a lawyer, but I'm really grounded in reproductive justice and social justice and human rights. And so, um, the benefit of that, right, you get to have a sense of your grounding, your foundation, who you are in terms of your identity. But then also the other benefit is like the health piece. And so it's important, if we have the privilege, right, of talking to people like our blood kin, and to be able to ask a parent, or if the parent is not the one that you can have that conversation with, is it like the grandmother, or is it the uncle or the auntie, or is it the children, right? Like, I'm asking my cousins, not my cousin, I'm asking my siblings, like, what did you know about such and such, and like, what should we expect? And so I don't want to put the whole onus on us, but if people
Right.
can, right? But if people can, it's important because, like, when people die away from a cancer, I'm like, I don't mean to, the clinician means, like, I don't want to be nosy, but like,
Right.
to preserve the dignity of that person, right? First and foremost. But if we can share information around the health reasons, then that's one way. But there's also other things that are happening in our neighborhoods, in our environment, that impact our health that we don't have control over. So I don't want to put the whole responsibility on the individual to achieve health and wellness, but I want to say it's everything, all the systems and structures, right? The ability to have like
Right.
access to like clean water and fresh food, to be able to have housing, right? That's
That's
stable
another
and
whole
safe.
hour of conversation.
But I do think it's important. Like, I get excited around like health history in
Yes.
our families, not to um, stigmatize or shame people, but I just think it's always just important to like have an understanding and awareness of what things do run in our family.
Yeah.
So that as we live hopefully full, long lives, right? That's what we hope and pray, that if we decide to build a family, with, through our bodies, what types of things should we be should we be aware of?
Okay. Well, again, I know I can spend hours and hours asking you tons of questions because I love learning. It doesn't matter where it's coming from. I will say this. I really appreciate you taking time out because you are like the busiest person I've ever met, internationally known, I'm sure by now. So,
No.
so you have to do classes. But what would you leave our Black women with as far as maintaining a sense of self? Because a lot of people, like you say, we're well into our 30s before we feel like, okay, I need to figure out what's going on. So what is something that is just something across the board that we should just take consideration of, even if we got to tell like the youngest sibling at 12 or 13 as Black women, in order to start taking control of our health of our body, or more importantly, our reproductive system?
Oh, that's a big question, Kim. So first and foremost, I'm going to share what Jessica Roach shared with me, who's in Columbus, Ohio. She was one of my doulas through my experience. She taught me that first and foremost, that we are valid at Black, and at woman. And so that mantra, it's a fact, and that truth grounds me in the sense that because I am, I'll say we are valid as Black women.
Yes.
In
Yes.
that validation, we are deserving, right, of joy, of comfort, of peace, of protection, of health, of wellness. Like, we are deserving of those things, and that is a part of our humanity, and that is how we grow and develop. We should be nourished and nurtured, I believe, in every interaction. So with that, I would say that, take time. I would take time to reflect about the fact that you are valid, and what does that, and how does that show up in all of your interactions, in your decisions that you make with your body, through your body, for your body. How is it serving you in terms of that, whatever you do, aligning with the fact that you're valid and you're worthy. So that's why I just said that we're worthy and we're valid. We don't
Okay.
need to do anything else.
Okay, so ladies, keep that in mind. I mean, that's mind, body, spirit. Once you have that foundation set, just like Dr. Scott said, that you should be able to make those wise decisions about your health, your mind, right? Making sure you have a healthy reproductive system. So put things in your body that nourish you, as well as feed your soul. So I like to thank you again, Dr. Scott. I'm not gonna
Thank
take up a lot of your time, but if you have any questions, make sure you follow her. She is a book of knowledge. She's always sharing gems. And hopefully we can have her back when I have a much bigger platform. So
It's happening. I believe it. Thank you
so
for.
she can share. So anything else that just comes to mind, I mean, I really appreciate it. So I'm not gonna take up your time.
No, I appreciate you, and I am envisioning you, you know, being where you want to be, and that's what I just want to inspire all Black women to do. It's just like, see it, believe it, write it down, trust yourself, really trust yourself, and that spirit inside of you. And don't minimize yourself for anybody. So I believe you. I believe you're gonna be where you want to be. And this
Got it.
platform is gonna be big. So I'm just celebrating with you right now, and I'm grateful for you. Thank you.
Thank you so much.